Hello, everybody. Welcome to Class 21. Today we're going to be covering pandemics/diseases.
Three, two, one. Ebola outbreak. Ebola was first described in 1976 with two simultaneous outbreaks in the Democratic Republic of the Congo and what is now South Sudan. The 2013 to 2016 outbreak caused by Ebola virus, EBOV, was the first anywhere in the world to reach epidemic proportions. Previous outbreaks have been brought under control in a much shorter period of time. Extreme poverty, dysfunctional healthcare system, distrust of the government after years of armed conflict, and the delay in responding for several months all contributed to the failure to control the epidemic. Other factors per media reports included local burial customs of washing the body and the unprecedented spread of Ebola to densely populated cities. As the outbreak progressed, the media reports many hospitals short on staff and supplies were overwhelmed and closed down. Hospital workers who worked closely with the very contagious body fluids, and therefore especially vulnerable to contracting the virus. In August 2014, the WHO reported that 10% of the dead had been healthcare workers. In September 2014, it was estimated that the affected countries' capacity for treating Ebola patients was insufficiently by the equivalent of 2,122 beds. However, by December 2014, there were enough beds to treat and isolate all reported cases, although the uneven distribution of cases was resulting in serious shortfalls in some areas. On August 8, 2014, it declared the outbreak a public health emergency of international concern. In March 2015, the United Nations Development Group reported that due to decrease in trade, closing of borders, flight cancellations, and drop in foreign investment and tourism activity fueled by stigma, the event has resulted in vast economic consequences in both the affected areas in Western Africa and even other African nations with no cases of Ebola. On 31st July 2015, the WHO announced an extremely promising development in the search for an effective vaccine for Ebola virus disease. While the vaccine has shown high efficiency in individuals, more conclusive evidence was needed regarding its capacity to protect populations through herd immunity. In August 2015, after substantial progress in reducing the scale of the epidemic, the WHO held a meeting to work out a comprehensive care plan for Ebola survivors and identify research needed to optimize clinical care and social well-being, stating that the Ebola outbreak had decimated facilities, families, healthcare, economies, and social structures. The WHO called the aftermath of the epidemic an emergency within an emergency. A special concern is recent research that shows some Ebola survivors experience a so-called post-Ebola syndrome, with symptoms so severe that survivors may require medical care for months and even years. As the main epidemic was coming to an end in December 2015, the UN announced that 22,000 children has lost one or both parents to Ebola. On 29 March 2016, the Governor General of WHO permitted the public health emergency of international concern status of the Western Africa Ebola virus epidemic.
Black Death. What is the Black Death? The Black Death, also known as the pestilence or the great mortality or the plague, was a bubonic plague pandemic occurring in Afro-Eurasia from 1346 to 1353. It is the most fatal pandemic recorded in human history, causing the death of 75 to 200 million people in Asia and North Africa, beginning in Europe from 1347 to 1351. Bubonic plague is caused by the bacterium Yersinia pestis, but it might also cause septic, anemic, or pneumonic plagues. The Black Death was the beginning of the second plague pandemic. The plague created religious, social, and economic upheavals with profound effects on the course of European history. Today, a vaccine exists and bubonic plague is easily cured with antibiotics.
Plague of Justinian. Death 25 million caused bubonic plague. This plague killed around half the population of Europe. The plague of Justinian was an outbreak of the bubonic plague that affected the Byzantine Empire and Mediterranean port cities, killing up to 25 million people total, regarded as the first recorded incident of the bubonic plague, killing up to a quarter of the population of the Eastern Mediterranean and devastating the city of Constantinople, where at its height it was killing an estimate 5,000 people per day and eventually resulting in the death of 40% of the city's population. Plague of Justinian spread through fleas. Studies indicate the plague might have originated in China or India and was then transported to the fertile valleys of Egypt through traded routes.
Hello, my name is Jason Lamb. Today I'm going to be covering the Spanish flu, otherwise known as H1N1. So the Spanish flu, when did it start and where did it start? Well, many scientists are still unsure of the Spanish flu's true origins. However, there are many different origin places of which it has been speculated to have begun. However, the first case, at least the first known case, originated within the US at a base called Fort Riley. Private Albert Gitchell was first reported to have the virus, and he reported having symptoms of which were very similar to the flu. This began on March 11th, 1918. The time of the Spanish flu's outbreak was extremely important to how it played a role inside modern society, as the Spanish flu broke out in the middle of World War I. The Spanish flu affected both sides of the conflict, affecting both the Central and the Allies. And in its spread, it was transported through train, plane, and other modern transportation methods to spread itself all across the globe. The Spanish flu is considered to be one of the first modern flu pandemics ever to have originated. The reason why the Spanish flu got its name is because when the US was covering, or at least when the US was having the Spanish flu outbreak within its own territories, what was basically happening was that because they were in the middle of a war, the US didn't want the Germans to know that there was an outbreak within the US. So instead, the US basically banned any news outlets from publishing any information about the Spanish flu within US borders. However, they did permit information about the flu to be spread about other countries like neutral Spain. And because the flu was in neutral Spain, the news portrayed it to be that Spain was hit especially hard by the virus, and many people nicknamed the flu the Spanish flu because of the news. The Spanish flu, of course, came in the flu season, and many people wrote it off as just being, well, your yearly flu. However, the flu of 1918 was especially different in that it was much more deadly and much more lethal than the flus of which had came before it. There were two waves to the Spanish flu. As I've already mentioned, the first wave came as actually a normal flu. The flu came in and it acted as normally flus would. And it gave people, of course, sore throat, fevers, and all the other symptoms which would usually come with the flu. However, some scientists theorize that after the flu spread into the trenches, it somehow mutated or somehow gained different genes, which caused it to then mutate and turn into the much more deadly second wave, of which hit the globe much later. The second wave was a much more deadly flu, and this wave had extreme adverse effects when it infected somebody. Victims who were affected by the flu could die within hours or days of developing their first initial symptoms. And many of the patients or those infected would have their skin turn blue and their lungs would be filled with their own body fluids because of the virus basically clogging up their lungs, causing them to suffocate within basically their own bodies. This is why their bodies turn blue, because of suffocation. And it was extremely dangerous, especially in the second wave. As I've already mentioned, this affected both sides of the war. And when it came into the heart and the homeland of the US, it killed thousands upon thousands of people. This flu was extremely dangerous. And some stories of which I read while researching this flu was that there was a military base. This wasn't Fort Riley. This was just a military base of which was enlisting its people, enlisting soldiers to go and fight in the war. What happened was scientists came to the military base, the person who's at the top of the military base, the general or whatever. They went to the general and informed him of the Spanish flu. What ended up happening was that the general passed off the Spanish flu as being just the normal flu. And he decided to still enlist the men into the army and bring them towards the camp. What happened later was that a large amount of the people who went to that camp and the people who were trying to go to that camp did die of the Spanish flu. And the general ended up committing suicide. Anyways, next slide. So, what was its significance? This flu killed an estimated about 500 million people. This is around 1/3 of the world's population at the time. And actually, no, 500 million people became infected with the virus, and 1/3 of the world's population was infected by this virus. However, 50 million worldwide were killed by this virus, and 675,000 of these kills were of United States citizens and or soldiers. Of course, as I've already mentioned, the pandemic affected both sides of the conflict of World War I. And because of how basically this pandemic came in the middle of the war, both sides were actually bogged down by the virus. It actually first hit the Allies first. So what happened was the Allies caught the flu, and for a time, the Germans were able to start winning some of the conflicts. However, the infection then spread over to the Germans, which caused them to be bogged down. And from there, the Allies then recovered from basically this virus and started to attack the Germans while the Germans were still infected, and basically the Allies started winning. This virus kind of played a semi-significant role in the war of World War I, and this virus was both extremely lethal and was extremely dangerous at the time. Of course, as I've already mentioned, it was probably one of the first modern pandemics flu pandemics, as it used the modern innovations of transportation against our own population.
So the next topic is AIDS and HIV, which is basically the same kind of disease. So the overview of this disease, HIV is a shortened version of human immunodeficiency virus, and this is classified as STI, which is stands for sexually transmitted illnesses. And the only way you could get this illness is if your mother or father had this disease and you were born with it, or you and partner uh, your partner may have given it to you through either sharing like a needle that was not properly cleaned, which may be the most common way HIV is transmitted. HIV also how HIV works is that the HIV cells, which are the bad kind of cells, attack the immune system directly, and it targets CD4 blood cells, which is a protein that is important in supporting the immune system. So it basically kills all those important cells, and basically makes your immune system like not function, basically. And if not treated, it leads to AIDS, which is the final stage of HIV, where most people die. And right now, HIV has no cure yet. We don't have medicine to prolong your lifespan. So if you have HIV, you have it for life. So the origin of HIV, it originated from Africa, from a chimpanzee from Central Africa. The disease jumped from chimpanzees to humans. According to the CDC website, they think that it was because humans hunted chimpanzees for food, and when humans were cooking it or eating it, the meat, I guess, the disease in the meat transferred into the human body, and that's how it began to spread. And this disease was exposed to us as far back as the 1800s. So stage 1 of this HIV. So stage 1 is called acute HIV infection. And as I said earlier, it attacks the CD4 cells, which is important to the immune system. It's an important protein, which is very important to how the immune system functions. So during this stage, the HIV cells are very active in reproducing within the body, meaning that it jumps from blood cell to blood cell very fast. And during this stage and throughout the whole time, you may experience flu-like symptoms. Sorry, I had a typo there. It's supposed to be symptoms, which include like throat might be sore, muscle soreness, all those kind of stuff like fever. While some may feel these symptoms, some may not feel at all, and they could go on for a long time not knowing that they have it. But if you do have these symptoms and you think that you have HIV, you should be getting tested at like your hospital or something, anywhere that does HIV testing. So stage 2. Stage 2 is called chronic HIV infection. It's also called chronic latency. Because of stage 1 with its fast HIV cell production, there's it kind of slows down in stage 2, and the reproduction rates of HIV cells in your body slows down. And at this stage, it's very HIV is most commonly transmitted at the stage to other people. Maybe your significant other through, as I said earlier, through a shared needle, which may not have been cleaned off properly. or genital secretions. That may be another way that you get HIV. Now, this stage can last more than a decade, while some other people may have it just 1 or 2 years before moving on to stage 3. And as HIV cells increase, the CD4 blood cells can't decrease because HIV cells are directly attacking those CD4 cells. And because you have a lack in CD4 cells, it makes you vulnerable to other illnesses such as like the common cold. And with that, the common cold, that's what kills you, not HIV, because you're very vulnerable without your immune system. So stage 3, which is where most people die, it's called acquired immunodeficiency syndrome, which is shortened to AIDS, and it's the most severe stage, and it's the last stage too. Throughout all those years of having HIV, your immune system is very, very badly damaged. And as I said earlier, since you have a lower blood count of CD4 proteins in your immune system, you're very vulnerable to other illnesses such as colds and flus, which those are what kill you since you have a weak, very weak immune system. And without treatment, patients will die within 3 years, about. And treatments include only like medicine to like prolong your life. There's no actual cure for this. So the HIV/AIDS is considered a global pandemic still in 2021. And this disease peaked around the mid 1980s. And as of 2016, 37 million people still have it, which is a pretty big amount of people infected. And in the sub-Saharan Africa, where it originated, in 2010, the CDC did a survey, and about 68% of HIV cases were located in the sub-Saharan Africa, which covers like 80% of all Africa. And 66% of deaths was also in sub-Saharan Africa, which is about 1.2 million people. And AIDS and HIV is the cause of death in about 10% children, 10% of children, which is a pretty big amount, thinking how big Africa is and how many people are living there too. And 5% of adults are infected, which is also a lot of people too. So
this is malaria. So malaria is a life-threatening disease caused by parasites that is transmitted to people through the bites of infected female and Anopheles mosquitoes. And in 2019, there were an estimated 229 million cases of malaria worldwide, and over 409,000 people died. So this is still like a very much deadly virus in like developing countries. And children under age 5 are the most vulnerable, where most cases occur in the African region and over 94% of cases occur. Malaria is caused by Plasmodium parasites. The parasites are spread to people through the bites of the mosquitoes. And history. In the 20th century alone, malaria claimed between 150 million and 300 million lives. And it was first detected from 3200 to 1400 BCE in like Egyptian bodies. And it's mentioned in many literary works, and it was like officially discovered in 1980. And nearly half the world's population was at risk of malaria. Some population groups are at a considerably higher risk of contracting malaria and developing severe diseases than others.
Yellow fever. Yellow fever is a disease caused by a virus that is spread through mosquito bites. Symptoms include fever, chills, headache, backache, and muscle aches, and the symptoms takes 3 to 6 days to develop. Around 15% of people who get yellow fever develop serious illness, which can lead to bleeding, shock, organ failure, and sometimes death. The yellow fever virus is found in tropical and subtropical areas of Africa and South America. There has been many yellow fever epidemics over the years, with the most recent one in 2016. Yellow fever virus originated in Africa and was brought to the Western Hemisphere during the slave trade era. The virus is spread through mosquito bites from an infected mosquito. Travelers to certain parts of South America and Africa are at risk for yellow fever. There has been many yellow fever outbreaks, and the worst American outbreak was in Mississippi Valley in 1878. The outbreak originated in New Orleans and spread up the Mississippi River and inland. Through spring and summer of 1878, over 120,000 cases were recorded, and the number of deaths was around 20,000. Memphis, Tennessee was hit the hardest, with around 25,000 residents fleeing the city. To prevent yourself from contracting yellow fever, use insect repellent and wear long sleeve clothes when in parts of Africa and South America. Additionally, it is recommended to receive a yellow fever vaccine. The vaccine is safe and affordable and is usually effective through life. However, there is no specific medicine or drug for treating yellow fever.
Okay, Asian flu, also known as H2N2. So, the Asian flu, originated in, Singapore in, February 1947. So, it first started there, and then is, eventually spread over the course of a few months to other countries in East Asia, including China. The biggest one is China, but it also spread to other countries like Thailand, Myanmar, Vietnam, and like Cambodia and stuff. Alright, so then after a few months during like midsummer, which was, I believe it was like, I don't know, like 4 months later, it spread worldwide to United States and Europe. And at first there was a low number of infected people, and people thought that it was the worst was already over. But then a few months later, new reports came in, and there was a high number of infected people, and it was mostly the majority of the those infected and those sick were the children, the elderly, and pregnant women. And when wave 2 hit, it was during December. It was very devastating, and it caught a lot of people off guard. And so it ended in March, and it killed over 70,000 people in the US alone. So the result of that was scientists, they studied the virus, and it was the second influenza pandemic in the 20th century. The scientists that studied the virus found that it had 3 different genes from the avian influenza A virus, which is a strain of the virus that is found in birds. And they came out with the vaccine for it later in like 1980, I believe. And they also created antibiotics for it to fight off secondary infections.
Measles.
What are measles? Measles is a highly infectious disease of the respiratory system that can cause major complications to the body. Measles are usually spread through airborne droplets such as coughing and sneezing, as well as small aerosol particles. Measles are highly contagious, and 9 out of 10 people who have been near an infected individual get the disease. However, measles can be prevented with the measles vaccine, which most people took when they were between the ages of 12 months to 12 years old. In 2019, there was an outbreak of measles causing over 5,000 deaths and 250,000 infections. Some symptoms of measles include high fevers, red eyes, and rashes that spread all over the body. The initial start of symptoms is having a high fever. Small white spots known as Koplik spots may form inside the mouth 2 or 3 days after the start of symptoms. Recognizing these spots early on can help reduce the spread of the disease. Several days after the fever starts, a rash starts to form from the back of the ear to most of the body in just a few hours. Measles can lead to life-threatening complications, such as pneumonia and permanent brain damage. There is no treatment for measles, but supportive care can improve the condition. Some examples of supportive care include oral rehydration solution, medications to control the fever, and antibiotics. Not everyone can get the measles vaccines, but there are ways to prevent the spread of measles. Some ways to prevent the spread of measles include practicing good hand hygiene, avoiding coming in contact with people who are sick, and avoiding sharing personal items with people who are sick.